As our short 2020 summer is rapidly coming to an end, there's a heightened concern that a second and possibly larger wave of the coronavirus is looming. As with COVID-19 Part 1, those most at risk are seniors. Many of the lessons learned from the initial outbreak form a 17-point draft recommendation that will help to guide institutions, seniors' care facilities, and healthcare providers. When it comes to keeping a step ahead of COVID-19, there are no simple solutions, other than to analyze our experience so far and to put the best preventative measures into practice as soon as possible, says Mike Klassen, the acting CEO of BC Care Providers and NHBC. The care equation is complex. Different facilities have different needs, layouts, staff and volunteers. Families want access to their loved ones. The number and mix of people in and out of care facilities is hard to monitor, manage, and control due to the myriad elements in motion, any one of which could introduce the virus to a facility. I invited Mike Klassen of the BC Care Providers Association and NHBC to join me for a conversation that matters about preparing for COVID-19 Part 2.
Conversations That Matter is a partner program of the Centre for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the following and viewers like you. Please become a patron at conversationsthatmatter.tv.
Mike Klassen, welcome. We find ourselves in a very interesting situation with COVID having been hit us, and nowhere more so than within seniors care facility. It's like we kind of got that under control right at the moment, but everybody's sitting on pins and needles saying, what's the next wave going to be? You've developed a strategy. Let's talk about that strategy and how all of us can maybe learn from it, but also ensure that those people who are in care facilities are protected.
And that's the main goal is making sure that we keep residents, staff, and family members safe. And I think this has been probably, without question, the darkest hour for the long-term care and continuing care sector. And it's not as though we couldn't see it coming. There have been systemic issues that have been there for a long time. Mm-hmm. They include basically issues around funding, the will to get behind a really robust hiring program that will allow people to look and attract new people to the sector. It's been shown through the labor market outlook to be the highest growth of any job sector in Canada for the last several years, and it will continue to be so because of the aging baby boom and the large growth in population of elder people in Canada. So we need to really respond on the hiring front. We also have infrastructure that is falling behind. In British Columbia, we have a bit of a different story to tell than other parts of Canada, interestingly. And it was partly because some of the things that are being sort of blamed for the problem today, which is the fact that we invited more private sector involvement into the care sector. So at BC Care Providers, we basically represent the majority of people who are either nonprofit or for-profit organizations. The companies, either small individual companies, some are very small with just a few beds, more like a mom and pop type of operation, to large chains that have multiple sites. And in all those cases, we've seen more investment in capital and infrastructure over that time to allow us to renew some of that bed stock. It has been falling behind, though. We have a report that we issued last spring called the Bedlam Report, and the Bedlam Report is a very sobering look at what the future of long-term care and assisted living is going to be in Canada.
And that report was pre-COVID.
It came out, exactly. It came out last year, and it was, again, our warning bell that we need to make these investments and we need to start looking at this now. We can't have these older multi-bed wards. What's really shifted, and I think this is why it's hard to appreciate, is we're living longer. Mm-hmm. We're living to our ripe old age that we never thought possible before. The average age in a care home is around 87, 88 years old now. And so people are easily living into their 90s now, whereas when you retired back at the age of 65, you'd be lucky for 4 or 5 years, and before you know it, you'd be, 6 feet under. And so now we have people coming into the care setting with much higher levels of acuity and much more prevalence of cognitive decline, dementia. And as a result, that's creating a lot more demand.
Well, and their natural defenses within their body have now diminished. By the time you get into your 90s, there's just no way that your immune system is as robust as it was even when you were in your 80s. And so it doesn't take much to put you in great peril. Now, you touched on a couple of things here already that if you don't think it through, you think, okay, well, what happened? Like, how come all of a sudden long-term care facilities were so vulnerable to COVID? Like, what were the circumstances that made it a perfect incubator for the disease?
I think there's a number of factors. First of all, COVID skews very heavily on people with mitigating health conditions. So if you're older, you're more frail, you're going to fall prey to this. And I've heard stories of people getting symptoms, and 2 days later they've passed. It can happen very quickly. The other thing about COVID is that you can be asymptomatic for days at a time. There are some reports as long as 2 weeks. Yes. Somebody could be walking around, spreading the disease, and not even know it.
And this is why we want people to self-isolate for a couple of weeks.
That's right. So that was an early precaution that was recommended way back in February and March, and I'm glad that we did that. That probably saved a lot of lives. But what we failed to really understand early on, and that we're getting to understand more, is that this virus transmits through the air, through droplets that drop usually because of gravity, maybe a few feet in front of you. That's why we have this 2 meter, 6 feet social distancing. But when you are, breathing heavy, or if you're speaking loudly or singing, as we saw the choir in Washington State, where so many people died and got COVID, those particles can go even further. Mm-hmm. So it's a situation where we're now starting to understand that the use of masks are absolutely critical. Even if not necessarily a self-defense, a defense for those around you. The care home setting too, one of the things that we saw is that people with dementia are hard to settle down and restrain. We've moved away from physical restraints and chemical restraints. We don't like to try and put people under to control them. And so as a result, people with dementia wander. Yeah. And so they will wander. And that's what happened in the case of Langley Lodge, where they had such a high outbreak. It happened in their in their dementia unit wing of their care home. They were able to isolate those people, but they had almost no opportunity to try and stop them from spreading the disease amongst each other. As a result, we had over 20 people die.
People who are suffering from dementia not only wander, they collapse physical distance spacing without even thinking about it. Right. And so, and therein increase the likelihood of transmission. Not just when dealing with people with dementia, also we look at care facilities, and you talked about no longer having multi-bed wards and so on. I'm sure that the average person goes, what, multi-bed wards and long-term care facilities? Why do we even have that? And yes, you're right, we do have to move away from it. But then the next question is, well, how do we do that? Because that requires more space, more beds, more resources. And so what is the plan moving forward to try and create those environments that will allow people to have greater safety?
So 2 parts to that, a little bit of context. Multi-bed wards are really a vestige of the 1960s and 1970s style of care, where you literally drove up in your car, got out, they put you in a wheelchair, and you went into your room. It was, now today, you don't come in on your own steam. You're usually helped in. In long-term care means that you have the kind of health needs that means that you have to be carried into or wheeled in some way. So those old hospital-style buildings were quite suitable for those times because people had much different circumstances. Today, people don't want to have that experience. They want to have single bedrooms. They want to have their own person, their own space. It has to be like a home. It can't be a hospital bed. It has to be like a home with your own dresser drawers and your own photos of your family members and your own TV that you can watch, and not just a curtain between you and somebody else. And so that change, that shift, has happened slowly but not fast enough. And part of the reason we have been heavily focused on some advocacy in Ottawa is because the federal government are the ones that have the financial ability to support financing of new infrastructure. They're doing it for housing right across the board, and they're even doing it for seniors housing. But because long-term care and assisted living are deemed to be health care and not housing, they fall outside of the boundaries of the kind of low-interest loans and other kinds of programs in the National Housing Plan. So we're trying to change that. We're trying to get the federal government to belly up to the table with the access to dollars that would allow us to renew some of that bed stock.
Are they listening to you?
Well, there's a lot of things going on in Ottawa these days. A lot of scandals, unfortunately, that are taking their eye off the ball. But we have been pressing them we've been pressing them for years. I've been on Parliament Hill several times. I was there as recently as last February talking to members of Parliament and government staffers, and we got a lot of appreciative nods and thank yous, and I hate to say it, but kind of patted on the head and said thanks very much, and we went back home. But we have been telling them repeatedly they need to invest some serious funds in order for us to renew the bed stock, so really get access to those infrastructure dollars that are being doled out in other parts of the country. And then we also need to have some funding to allow us to do a broad-based training and recruitment program right across the country, because the whole country, and I'm thinking particularly some of the small communities around the country, are the places where you're really going to have a hard time finding people to take care of you when you get old.
In your 17-point plan, I also note that you talk about staff only working in a single site. And I think for a lot of people who are not in the care community, they would go, what? What do you mean only work in a single site? Don't you already do that?
Mm-hmm. So what we discovered through this process is almost 9,000 British Columbians were working at multiple sites. Now, it has been positioned as a way to make ends meet because they're not earning enough money. And I'm sure that's the case with a lot of people. And then there are others that just like to try and earn as much as they can and are working at the top end of the wage scale through in a hospital or in a unionized site that has the master collective, the highest rates paid in the province. So what that single site order quickly showed us is that we are really short on staff. And it really laid bare the fact that we need to get out there and start finding, and this is something that BC Care Providers has probably been the loudest of any organization in the country. I mean, we work with the Canadian Association of Long-Term Care, and I'm on their board. So we have been trying to take that message nationally as well. But we have been really adamant. I'm surprised that we don't have more support from other groups. For example, the Seniors Advocate doesn't seem to think there is a hiring problem or a lack of staff. She said on many occasions that she thinks that we've got plenty of people. Well, 9,000 employees working in multiple sites, now going to have to work at one site only. What's going to happen to all those lines that need to be filled right now? And for us, it's simple. We have to invest in new training and new recruitment programs.
If you do the math, let's say one person works at 2 facilities of 9,000. That's 4,500 facilities that are going to lose a human resource. Mm-hmm. And how do you fill that? How do you fill that with a skilled person and in short order? Because time is of the essence here.
Well, there are some ideas out there. First of all, what we're facing is increasing overtime, and you don't want to burn out your staff. It's already been happening through the first wave of COVID. Right now, we're kind of in the near end of the summer, and so as a result, people are taking a bit more vacation and hopefully catching a bit of a breath before what we think will be coming in the fall when flu season and potentially a second wave of the pandemic comes in. So what we don't want to do is we don't want to burn out our current staff and make them run away from our sector. We want to make their lives fulfilling and their work fulfilling. So what we are in discussions with the provincial government on is some way of taking people and inviting them into work at a sort of a comfort and support worker level, which is a kind of an entry level position that acquaints them with the care home setting and allows them to do non-medical care, but would allow them to provide important support within the care home setting. The government announced at the beginning of July $160 million, and with a bit of a sense that that plan will start to unfold. So we are in regular dialogue with the Ministry of Health on how we can maybe fulfill that and start getting some of the people into the care homes. And we have a really obvious part of our economy that might be a good place for us to go, which is the hospitality sector. Hospitality has been hit very hard by COVID. A lot of bars, pubs, resorts, and other businesses are now going to really struggle to open again, if ever. So you have all the employees of those places that do things like housekeeping, they do dietary services, they're good with people. They would be really a natural fit. And so way back in March, one of the brainchilds of our board president, Ali Debji, was to reach out to some of the big entertainment facilities. So we ended up working with Canucks Sports and Entertainment for a program we called Operation Canucks. And so after talking to Francesco Aquilini, what that organization decided to do was to essentially provide staff to come and work in care homes. And they paid for some of our nonprofit operators, they paid the salaries from some of those folks to be seconded into working in care. That was our first toe in the water on this idea. We think that we should expand that in a much larger way and look to sectors where people, and the truth is, I think a lot of people would like to work in the sector, are good with elderly people, would like to have the steady and the good benefits that come with the job. It's just, how do you do it? We've got CERB, we've got other things that kind of get in the way. You have to pay your rent, your phone bill, and all the rest of it. And so we have to find ways of making it easier for people to come into the seniors care sector.
So what's going to happen with the volunteer sector? Because long-term care facilities have relied fairly heavily on volunteers over the years. What role will volunteers be allowed to play as we move forward? Because now there's going to be all kinds of liability issues, and with a heightened awareness around a strict adherence to personal protective equipment use and doing everything you can to reduce the likelihood of transmission, will that volunteer sector still be allowed to participate and help provide that care?
I'm really glad you asked that question, because I consider this, and I think our organization considers this to be one of the absolutely critical issues. It was the fact that we closed the doors to family members and loved ones and volunteers that really were a vital part of the care teams within long-term care and assisted living. And so now what we're faced with is these heartbreaking stories from all over the province where couples who've been married for 50, 60 years can't see each other anymore, can't hold each other's hand. Family members that are looking through windows, they've got parents who have got dementia, don't really understand what's going on. It's really difficult. I think that if we take anything away from this first wave, and I grant you, we did not know what COVID was going to do back in March when these orders were initially. We had to err on the side of safety, and the best way we could do that is to exclude people from the care home setting and try and keep everybody safe. But what we started to see is the decline of the residents in their cognitive abilities and their physical health all started to result from that lack of social interaction with their loved ones. So we need to come up with a really robust plan. And I think that the ministry has an important part to play, care providers have an important part to play, and as a result, it forms the basis of one of our recommendations in our sort of next wave plan, which is we have to keep that social contact in place. If there's an outbreak, of course that would change. You don't want to have the spread of the disease, but if you have a setting and you don't have any presence of COVID-19, then we should find ways to make sure that we can keep people connected in some way.
So as we go into the fall and we're concerned, are you feeling that people who are within the long-term care sector are as prepared as they can be?
I would like to be honest with myself in the sense that I think everybody is working really hard to try and make sure that they can to do their very best. And I think there have been some incredible stories that eventually I hope the public hears on how hard people worked and the real dedication and passion that we saw from care home operators and their staff. But we have to continue to work very hard and collaboratively. This is why we've been using the phrase Team BC as our mantra. We've been working very close with the Ministry of Health. We meet with them multiple times. We were meeting with them multiple times per week for the first few months of the pandemic. We now meet on a weekly basis with senior officials in the Ministry of Health. We've had regular meetings with the Minister of Health and the Deputy Minister of Health, who are very important to the critical decisions that we're facing right now in terms of preparing for the next wave. We've also been working closely with other partners within the sector, and I think it's just by working collaboratively that British Columbia has a bit of a different story to tell than what we saw in Ontario and Quebec. And I'm not going to point any fingers, but the numbers sort of speak for themselves. So the government and the Provincial Health Office knew of our support of ending non-essential visits, having single site work only. Those are the kinds of things that as an organization, we felt that we had to get ahead of. I think working together is the best way that we can get ahead of COVID.
And that is the strategy, isn't it?
I think it really is. I think it's going to be working together. I think acknowledging the good work of Dr. Henry and Minister Dix. It's really supporting our operators who are facing a lot of scrutiny and sometimes some unfair reaction to the work that they do. There's some hair-raising stories of what happened in the early days. I think we're starting to hear a little bit more of what happened behind the scenes, how many lines were working short-staffed and struggling as hard as they could, with including all management staff coming in and working to make sure they are delivering direct care and providing meals and all the rest of it. I mean, it really was a crisis, and I think at the end of the day, I think British Columbia will be able to look back and say, you know what, we stepped up and we responded as strongly as we could, and I hope that's what's going to happen continuing going forward.
Me too. Thank you very much for coming in and sharing where we're at and preparations for going into the fall.
You bet. My pleasure, Stu.